Is that a pretty good diagnostic tool? Is that a big advancement in ERCP?
That alone is not, but there have been some recent advancements. One of them is a new scope that there's actually a two-scope system where we use the big scope to get where we need to go, and then through that larger scope we'll put a smaller scope that actually we can go up into the bile duct and get direct visualization or actually see this, so I don't have to worry about the x-ray anymore.
What's that called?
That is called cholangioscopy or spyglass.
So that's a spyglass. How big is it?
It is very small. It is only about 2 to 3 millimeters in size.
So that's about half the size of maybe a pencil eraser or something like that. So when you go up there, you can actually see.
Yes.
And what do you look for? What does the cancer of the pancreas look like?
So we're looking for several different things. One can be ulceration, which is an ulceration is always an ominous sign or a scary sign when you see that. You can oftentimes see changes in the blood vessels in the bile duct, which makes you concerned that there is something happening in that area.
When you get the brushing, you can get the diagnosis. A couple other things I want to mention, and that's the ultrasounds. There's a new endoscopic ultrasound procedure. What's that, so people will know?
So that is called endoscopic ultrasound, or EUS, and what that is we will actually, there again, you're asleep for this procedure, and on the tip of a scope, it goes down through the mouth and into the stomach and into the small intestine. There is a small ultrasound probe, which you're actually able to put right next to the pancreas, so you're actually able to see that in really high quality visualization to get an idea of what's going on.
I think that's neat. So it's another way of identifying what the tumor looks like, but the ERCP with brushing can give us a diagnosis. Do you ever have to go in and get a biopsy?
Yes, and endoscopic ultrasound has that capability, and typically it is with a needle that they place through the wall of the small intestine and actually into the tumor itself, and they're actually able to get cells that way to evaluate under a microscope.
So really the diagnosis is getting better and better. Finding it early can be the only way of frequently having good positive results.
Yes.